Hello. Hi, this is Alanna Steaple, and this is the Mind Your Body and Soul Healthy podcast. Normally, I am flanked by Mr. Joseph Ward and Mr. Mathias Sweet. However, today it's me and Miss Katrina Ball, our wonderful certified nurse midwife. And remember that Mind Your Body and Soul is a healthy podcast or an educational podcast that focuses on all things health related. And we're there to help the listeners learn more about the various health topics and information that they may not have everyday access to. And so we seek to inform and educate, uplift, and mobilize our listeners to become the healthiest version of themselves. And so today we are continuing our series on women's health with Miss Katrina Ball. Like I said, our wonderful certified nurse midwife. And Miss Ball, do you mind just, for those who are new to you and were not able to listen to our first podcast, which we did over the summer, can you just give us a little information on your background?
Yes. Hello, everybody. My name is Miss Katrina Ball. As Mrs. Steaple stated, I am the certified nurse midwife here at Neighborhood Medical Center. I've been employed here for approximately 2 years, and I did receive my Master's of Science in Nursing after being a labor and delivery nurse for over 10 years. Currently, I see women across the lifespan from the time they begin having their menstrual cycles up until well after menopause. And I have the fortunate opportunity to also care for expectant mothers and their newborns after delivery.
Awesome. Now, really, come on, folks. That is, who can touch that? That's all I'm going to say. I did women's health. I didn't. Thank God for people like Miss Katrina Ball. So I think I neglected to tell y'all that I'm the Ryan White provider with the Ryan White HIV/AIDS program at Neighborhood Medical Center. We are Part C of the Ryan White grant. And so today, like I said, I just think women's health is just so important, Miss Ball. And so today we're focusing on sexually transmitted diseases in women, but also touching on pregnant women, as well as just a little bit of violence against women, but really focusing on the pregnant women. So Ms. Ball, I'm just going to leave it to you as to where to start off in reference to discussing sexually transmitted diseases and women.
Okay. Well, that is a very vast area, as one can imagine. I will start with some of the more common sexually transmitted infections that I see on a regular basis within the clinic, within the population that I service, as well as that the population is more aware of. So just to start in no particular order, and feel free to jump in at any time, Mrs. Steaple, but I'll start off with chlamydia, as that is one of the most common sexually transmitted infections in the United States.
Now, is that from when you see them young until, do you see more in the young than the old, or how does that?
It's really respective of the population. When you look at it in terms of women's health screening, yes, they do recommend that annually up until age 25, once a person becomes sexually active, that we should be assessing for chlamydial infection. However, in certain populations, with it being so prevalent, you want to continue to test annually. And that is something that in pregnant women, we're going to screen for that regardless of risk.
Okay.
because with chlamydial infections, it's one of those sexually transmitted infections that may not have any symptoms whatsoever.
Wow. Can you elaborate on that a little bit more?
Absolutely.
Oh,
Absolutely. So there are sometimes symptoms associated with chlamydial infections. That could be some spotting after intercourse. It could be some discharge. It could be some odor that you notice there. However, sometimes there may not be any symptoms. So you may not have any discharge. You may not have any spotting after intercourse. You may notice nothing abnormal.
wow.
However, when you come in for an assessment, your provider, when they assess you, they may notice some mucopurulent or some pus mixed with some white blood cells on your cervix. They may notice that your cervix may bleed easily when they are assessing it, or it may just come up incidentally on testing alone. And
Now, is
many
there any
times, go
pain?
ahead.
I'm sorry. Is there any
Oh, yeah.
pain associated with a
There
chlamydia
may
infection?
There may be some pain there, and most women will report some pain with urination.
Okay.
For men, they may have some different symptoms as well, some pain and some discharge from the penis.
Okay.
So
Okay.
there may definitely be some pain associated with it. That's correct.
Ah, interesting. Interesting.
Mhm.
So really, do you know how long it takes for those symptoms to possibly surface after a person has had intercourse with someone who's infected with chlamydia?
For the symptoms to surface, it can take anywhere up to from about 5 days to a week for those symptoms that they may surface. However, remember that there may not be any symptoms whatsoever.
Huh.
So, absolutely.
Wow.
Absolutely.
Wow.
Yes.
That's so another reason to use condoms, right?
Right. Absolutely. Absolutely. And unfortunately, in pregnancy, a chlamydial infection can cause even more, consequences for an unborn or undelivered child. We could have a preterm delivery. We could have a neonate or fetus who dies in utero or inside the mom's womb. We could
Wow.
have premature rupture of membranes. Their water breaks prematurely. And
Wow.
even with delivery, there can be infections of the eyes, there can be pneumonia in the newborn. So it's something that really does need to be tested for or assessed for in pregnancy, but just throughout the span period for any sexually active
Wow.
woman.
I do know, folks, that chlamydia is the number one
Yes,
sexually
yes.
transmitted infection or sexually transmitted disease. So okay, is there another sexually transmitted infection that you see along with a chlamydia infection, or do you just primarily see chlamydia by itself?
Many times with the chlamydial infection, you may have a gonococcal or gonorrhea that is present as well.
Oh,
So if I
okay.
don't have the specific results that show that a patient has chlamydia and does not for sure not, excuse me, and does not have gonorrhea, I'm going to treat them for both of them because
Oh,
many times they do happen simultaneously or both of those infections are present. So I do want to treat the
wow.
patient for both of those infections.
Interesting. So you can actually have two sexually transmitted infections
Absolutely.
at the same
Absolutely.
time.
Mm-hmm.
Wow. So that's even more reason,
Mm-hmm.
ladies, to get yourself checked out.
Mm-hmm.
Now I have heard about another sexually transmitted infection, trichomonas. Now,
Mm-hmm.
now can you just elaborate a little bit more on trichomonas?
Yes,
Am I
and
not?
that is one, yeah. Trichomonas vaginalis or Trichomoniasis infection, and that's one that not many people in our population or just many people know of. Many
Oh,
times that I diagnose it, patients are like, well, what is that? It is also a sexually transmitted infection. And again, it can be the symptoms. It may not have any symptoms, or you may have a malodorous or a vaginal odor, a fishy odor, especially after intercourse or sex. There may be a greenish or yellowish discharge. You may have some spotting after intercourse as well, may have some pain with urination. And many times on examination, when I'm looking, I can see a nice little strawberry cervix, or I see these little spots on the cervix that usually can give me a hint that, okay, we're dealing with a Trichomonas vaginalis infection here. So, yes, ma'am.
Okay. Now, men do not normally show signs of being infected with that particular, what we call protozoan. So it's almost like they pass it to the woman. The woman has more of
More
the
of the
of
symptoms.
gotcha, has more of the symptoms than the men. But please bring your partners in. You know, if you think, if Miss Ball diagnoses you with trichomonas, then please have your questions ready for her. So
Right.
just in the short span of time, that, I mean, that is, wow, that's amazing. So when it comes down to herpes, do you see a lot of uh, genital herpes in pregnancy, or just in women, period? Is that one of the sexually transmitted infections that you see a lot of?
It's one that is commonly encountered with many of my patients, many of my obstetric patients. Oftentimes, they don't have any symptoms, or they may have never even had an outbreak.
Oh, wow.
However, with the testing that I'm performing in pregnancy, I want to make sure that we assess for herpes simplex virus, or HSV,
Okay.
because if we have an outbreak near the time of delivery, then that can also be harmful to the newborn.
Oh, wow. Wow.
So for our pregnant women, we have to put them on an antiviral starting at around 36 weeks of pregnancy to try
Okay.
to prevent those complications.
Oh, so y'all do it prophylactically.
We
Yeah.
do it prophylactically
Okay.
beginning at 36 weeks because if you have that first or that primary outbreak in pregnancy, is a greater risk of there being a neonatal transmission or a transmission to the fetus. So we
Wow.
want to go ahead and begin to prophylactically, treat them at 36 weeks. If there is any outbreak near the time of delivery, unfortunately, that will warrant a cesarean delivery. We will have to bypass a vaginal delivery at that time.
Wow. So that's even more reason to stay
Right.
um to stay engaged in care
Right.
with your OB provider, because you have to get these tests,
Right.
right?
Right.
Because she said that if you do not, some of the ladies don't even have outbreaks,
That's
and
correct.
they still have the infection.
Mhm.
Wow,
And
wow,
that's typically when it's transmitted, that asymptomatic, that viral shedding. You don't
wow.
have to have an outbreak to spread that virus.
And so really you're placing your baby at risk
Right.
of acquiring a sexually transmitted infection, and they just got here. So you
Right.
definitely want to be aware of that. Is there anything else that we can really discuss right now in reference to those, before I get to the biggie? The biggie is
Right,
syphilis.
right,
Is
right, right.
syphilis.
Mm-hmm.
Discuss
Mm-hmm.
syphilis in
Yes,
women and
yes,
pregnant.
yes. Absolutely. And actually, I thought you were about to go to HIV. I was like, oh, she's ready to go to her baby. But
That's
But
kind
yes, syphilis is also something that we assess for every pregnancy because of those effects that it can happen, the effects that it can have on an unborn child. And I have had a few patients, as syphilis is on the rise within the community, I have had a few patients that I've had to treat during their respective pregnancies to try to prevent that neonatal transmission to the fetus.
so what can happen if a woman does not get her lab work done? She just
Mhm,
shows up
mhm.
and the baby is what is a mother, what is she placing her unborn baby at risk of? Is it mental retardation? I mean, intellectually
Mhm.
intellectual disabilities or
Yes.
visual impairment?
Yes,
Is she placing her?
definitely can have effects on the brain, effects
Oh
on
wow.
hearing, on vision. And one of the unfortunate things that I have witnessed is stillbirth or neonatal death because it wasn't something that was treated in pregnancy. And
Okay.
so, unfortunately, that illness or STI did transmit to the neonate.
Wow.
So unfortunately, that's the biggest, you hate to lose a child, but you can have those other complications as well.
Okay, ladies, please, 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 please get yourself tested. No, please stay in contact with your OB provider. So Ms. Ball alluded to the fact of my baby, which is another biggie, which is HIV.
Right.
So can you? I can talk to the cows come home on HIV, but minimal with women and pregnant
Yes,
women.
yes,
That is, so I'm going to let you take the reins on
absolutely,
that.
absolutely. And I know, HIV is like when you talk about the other sexually transmitted infections.
Mhm.
um, I don't know about you, but for some of my patients, it's like, okay, chlamydia infection, okay, but do I have HIV?
Uh,
Gonorrhea, but do I have, HIV? Unfortunately, chlamydia, gonorrhea
mhm.
predispose you to, to getting HIV. It
Yeah.
really does. Um, However, for our women who are pregnant and who are HIV positive, it's just important that they are in care for sure. It's
Okay.
important that they are on an antiretroviral therapy to
Okay.
try to prevent, again, that neonatal transmission,
Okay.
even at the time of delivery, because that is something from my perspective that we're looking at closer to that time of delivery, especially, we're looking at the viral load and we're seeing, okay, are we able to have a safe vaginal delivery? Do we
Okay.
need to plan for a cesarean section? And we want to make sure that we're treating in that intrapartum period or during labor and delivery or before cesarean delivery to try to prevent transmission to the newborn. And one of the great things about being on an antiretroviral therapy
Mhm.
and sticking to that is that that risk of transmission to the newborn is less than 1 to 2%. So we have an opportunity to not pass that along to our child.
That's that's really interesting because I call them Perrys. I
Mhm,
have at least five patients who are Perrys. That
mhm,
means that their mothers passed it on
mhm,
to them. They are actually um, healthy,
mhm.
socially functioning
Yes.
adults, but sometimes they're angry
Oh
at
yeah.
their mothers for passing that on. So tell me, do you consult with a, what do you call it, a perinatologist,
Yes.
uh, someone who deals with at risk pregnancy? Would you consider that a high risk pregnancy?
Absolutely. Definitely would consider that a high-risk pregnancy. As a nurse midwife, I'm going to collaborate with my
Mhm.
colleagues, which is going to be a perinatologist, which is going to be an obstetrician, which is going to be infectious disease. We want to have, and the pediatrician as well. We want to
Okay.
have everybody on board and on hand so that one, not only are we providing great care for the mother and making sure that she is healthy throughout this pregnancy and thereafter, but that
Okay.
we're also trying to prevent that neonatal transmission to this fetus so that we don't have any peris coming to you,
Ah,
after
you know
delivery.
that's a lot of specialists um, that the mother
Mhm, mhm.
has to see. So if she doesn't want to go from this specialist to this
Mhm.
specialist, she could just stay with you, but you
Abs-
consult
And
with the specialist.
Mhm. Now, we would try to mobilize resources as best we can so that
Oh,
she's not having to go from one person, one specialist to the other.
okay.
However, not all of us are in the same location. So, and that's with any particular practice. It's very rare that you may have the perinatologist in the same office with the
Oh,
obstetrician or nurse midwife.
okay.
And the pediatrician is someone that, we're going to bring in more so on the latter end. So once we're in the hospital setting, then
Mm,
while you're there, we'll have them come in as well to discuss the plan of care for the newborn. However, the main thing that I want to bring home is that I just want them to come into care. I just want the patients to come into care. If
yeah.
whatever resources I need to mobilize to you, if I need to get you transportation to these areas, we will get it done. We'll make it happen. We just got
Okay.
to get you to come into care.
Okay, because I will tell you, I've dealt with what, two or three pregnant women with you, Miss
Hmm.
Ball,
Hmm.
and I was so happy that Miss Ball was close by. I
Right,
don't mind
right,
dealing with women and HIV, but
right.
man, once it's mommy and baby,
Hmm.
like,
Hmm.
no, I don't
Right,
want to be
right,
responsible for two lives. No way. So,
right.
well, you know what? That makes me think, just discussing the different sexually transmitted infections,
Hmm.
that that makes me think of violence against women, and especially pregnant women. Can you just speak a little bit about that, Miss Ball?
Absolutely. And your pregnant population is going to be a more vulnerable population.
Why is
Not
that?
only because not only is it the mother, it's her
Mhm.
unborn child. She's at risk for, being in a situation where she's dependent on someone else to ensure that there's a roof over her head or that, her and her child are being cared for. She may have other small children that she's bringing up. And so, unfortunately, we do often see domestic violence, and it is increased in that vulnerable population
Wow.
of these
Wow.
pregnant women. And especially, you and I were talking earlier with things that are going on within our respective community where more people are at home, the lack of resources coming into the home,
Mhm.
um, the isolation, whereas a patient
Isolation.
or a mother may not be going to work or she may not be, getting out of the house as much, is a heightened risk for domestic violence.
Wow. Wow.
And I have a few patients now who actually have come to me, and I appreciate them for being honest with me about it because that's something that I assess for. I try to assess for every visit. And I try to speak to them like before they go to the restroom or whenever I can, just
Uh-huh.
so that they're alone and can feel safe to disclose certain things to me. But we've gotten them in touch with resources to get them out of those situations.
What are what are some of the resources that are in the um, tri community? No, there are really
Mhm.
four counties. What are some of the resources that are available to to a woman or a pregnant woman who wants to get out of the house from her abuser? What are some of the resources in this community?
A couple of them right off the bat are the Breon House, and that is a location that will cater to moms and babies. They can bring up
Oh,
to 1 to 2 children there with them as well.
wow.
If they have openings there, we have the Refuge House
Okay.
that we can utilize. Excuse me, to get parents or to get mothers out of certain situations too. We also have case managers here that can help us to utilize and mobilize other resources. On a couple of occasions when I haven't had an opportunity to get a patient placed the same day that I see them, I would even admit them to the hospital just to get them out of harm's way
Wow.
until we're able to mobilize the resources and get her, and her children in a safe environment.
So what do you do when you have the and just to clarify,
Mhm.
the abuser does not have to just be male.
Oh,
Trust
that's
me,
correct.
there are
Correct.
there are female abusers, but in this
Mhm.
case, we're talking about women and pregnant women. And so what do you do when the partner is right there? They're like, this is my baby.
Mhm.
Also, I deserve to be there. How do you
Mhm.
get them away in order to ask them that question? If you assess them every visit, how do you
Mhm.
get them away from this person?
And that's the thing. I have to try to find those opportunities when I can speak to them.
Oh,
So when
okay.
I'm calling the patient to the back to go to the restroom, or
Okay.
if he or she, the partner, has to go out for a phone call, I'm
Mhm.
utilizing whatever opportunities. Or if I pick up on some signs, whether the partner's always answering the questions for the patient, or the patient's not giving me direct eye contact, or she's very
Ah,
fidgety. If I pick up on signs like that, there may be times when I try to get a little creative with, okay, well,
okay.
mom, I need to bring you here just to draw your lab work. We'll be right back to this room. Whatever I can do so that I can have one-on-one, because it's very hard to speak of your abuse in front of your abuser. Um, so we try to do it as best we can, but it's something that definitely needs to be assessed on a regular basis across the board, throughout the community centers, throughout, the private offices, everywhere, hospital settings, everywhere.
I remember when I had, I think she was late teens.
Mm-hmm.
I never had this happen to me before, but I was slipped a note.
Mm-hmm.
I was like,
Right.
oh my
Right.
gosh.
Right.
And the person was sitting right there, had
Mm-hmm.
slipped a note, and I was like, what am I going to do?
Mm-hmm.
But I was able to separate the young lady from her abuser. So that is, ladies and gentlemen, the thing is that no relationship is perfect.
Right.
No
Right.
relationship is perfect. But if you are in fear of your life, you are in fear of your unborn child's life, you have an obligation.
Right.
Please let the provider know somehow, slipping a note or saying, I have to go to the restroom. Miss Ball, can you just help
Mm-hmm.
me,
Mm-hmm.
with this?
Mm-hmm.
Something, because like Miss Ball and I were talking about earlier, COVID. Can you elaborate on the impact of COVID-19 on women and especially pregnant women?
Are you stating in reference to
How?
violence, increase in
Yes,
violence rates, or okay, okay.
yes, yes.
Um,
Thank
similar
you.
to what I stated, before, it's you have more persons possibly inside of the home, whether that abuser may be at home more because they may not be going out uh, to work a job or whatever the case may be, or the pregnant woman herself may no longer be going out of the house. And it's more of, we don't want you at large gatherings. We don't want you, going to visit much family because, again, we're trying to flatten that curve or to try to get the numbers down, and it's not safe for us to be around a large amount of people. So those persons are going to stay at home. And when you have that stress level that is heightened and you're at home with your abuser, it impacts that. You're going to see higher rates of abuse.
Wow. Wow. That is, this is, to me, I just think the series on women's health is just so informative. I really, really hope that that the audience really pays attention. This has just been some great information, discussing the different symptoms that a woman or pregnant woman can experience in reference to a sexually transmitted infection. Some of the signs of possible abuse and what you may need, where you can go to receive help. But most of all, Ms. Ball is there. She is there to assess. So what you're saying, Ms. Ball, is you don't have to be pregnant to be seen by you.
No, you do not have to be. Any female, like I stated, from the time you have your menstrual cycle up until well after you are no longer having your menstrual cycles, well after menopause, may come here to be seen.
So now, because young girls are getting their cycles so much earlier,
they are getting them much earlier.
So a 10-year-old can come and see you?
Absolutely. They absolutely may.
Wow. Okay. Well, I see that you either a woman or a baby or
it's okay.
is waiting on you.
I apologize.
That's okay.
I apologize. You saw me looking to the side a couple times. I'm answering phone calls and text messages, but that's fine.
I take a back seat to babies. Okay. Yes. Babies, they have their own timetable. They have their own schedule.
They do.
I just want to say,
listen, I enjoy that aspect of it, but I enjoy this aspect of it as well. And this is very important, though, because, I'm seeing many, I only see women, but I'm seeing many young ladies and women come in with sexually transmitted infections, and many of them are asymptomatic.
Wow.
They are not having any symptoms. They're coming in for routine visits, and we're screening them based on some of the history that we get, or we're screening them because they're pregnant, and that is when these diagnoses are being made.
Wow.
And so I really just want everyone to stay in care, practice safe sex. And just because you don't have symptoms does not mean that you do not have a sexually transmitted infection.
Can you say that again, Ms. Ball?
I'm serious. Just because you do not have symptoms does not mean that you do not have a sexually transmitted infection. It does not mean that. It doesn't. And the time of onset from the time of your exposure to the time you may have symptoms, it varies, With chlamydia, it can be 7 days or more. With gonorrhea, maybe 3 to 5 days. With herpes, it may be a week. It varies. But again, you may not have any symptoms at all. So you need to come in and stay in regular care.
Well, I just want to say thank you, Ms. Ball, for this excellent podcast. This was wonderful. It just gets, not slighting the men, but these women health talk podcasts, they're just absolutely wonderful. So I want to say thank you once again, and I'm Alanna Steaple, one of the Ryan White providers at Neighborhood Medical Center, saying, please stay healthy, or I'll meet you at the corner of happy and healthy. And this is Mind Your Body and Soul podcast. We hope you have just a healthy rest of your week, and we'll talk to you later.
That's
Bye-bye.
right. Thank you for having me.